This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. Yesterday, an Israeli airstrike killed dozens of people at a school being used as a shelter for displaced Palestinians. Today, we check in with humanitarian organizations who have workers on the ground in Gaza. Before these airstrikes, the area was facing famine, mass displacement, and severe trauma from witnessing the ongoing war. Later this hour, we'll also talk about how humanitarian aid groups are helping in other crises around the globe, including in Sudan. Joining us now is orthopedic surgeon Dr. Ali Elidi, who is part of Fajr Scientific, a nonprofit organization that provides surgical care to the world's most in-need populations. He was also recently a medical resident at the Yale School of Medicine. Dr. Elidi, welcome to Where We Live today.
Thank you for having me.
And for our listeners, you're welcome to join the conversation. Let us know if you have any questions, 888-720-9677, or find us on Facebook and Twitter at Where We Live. So, Dr. Elidi, we'd love to start this conversation by asking you to give our listeners an idea about your connection to Gaza and also your recent trip.
So I was actually born in Gaza. All my extended family still lives there. We immigrated, my family and I immigrated as refugees when I was a child, and we moved to the United States. I actually didn't become a citizen of the United States until I was 18 years old, and it was a very difficult process through the political asylum and everything like that. But I've always had a pretty strong connection to Gaza, being born there and having all my extended family there. One of the main reasons I went into medicine, and I talked about in all my personal statements and interviews, was to give back to the people of Gaza. And I just finished my training at Yale. And with this war, I felt like it was my calling and my duty to finally contribute that promise that I made. And so that was a huge motivation for me. And this is by far one of the worst that I've seen happen in Gaza during my lifetime.
And you were there recently, I believe, in April. Can you tell us about what did your work look like when you were there?
I mean, it was some of the worst orthopedic trauma I've ever seen. I mean, New Haven has pretty bad trauma.
Mm.
This was at an even worse degree. I remember there was a specific instance where a child came in from a blast injury, and I was down in the ED, rushing him up to the OR. He had a really bad open femur fracture as well as a jaw fracture. And as we're moving him up to the OR, another lady's coming in with a gunshot wound to the leg. It was just a constant inflow of trauma and gunshots and blast injuries. And unfortunately, the majority of the things that I saw were done to women and children. A lot of the people that we operated on, a lot of the amputations that we did were on children, unfortunately. And it was just hard to see because I'm so connected to the area, and I was one of the lucky few that made it out of Gaza, and realistically, that could have been me.
Right. And we know that circumstances and need are very extreme in both aspects. And with what you described, and also with your personal connection, how does that help you or not really prioritize and delegate the care that you know you need to give to your patients?
And so that was a discussion that we actually had while we were there amongst the team. Um, in training, you do triage and you learn how to triage what's most important, what needs to go immediately, what can wait overnight. And another question that was brought up is how much of our resources do we utilize to the acute trauma versus ongoing orthopedic care? And at the end of the day, pathology and diseases still exist despite there being a war. The efforts have been mainly towards all the new wartime trauma, and we decided to utilize some of our resources to some of the general pathology and utilize that stuff. But at the end of the day, how things work in medicine is that you prioritize open fractures, you prioritize children. And so a lot of times, if a child came in that needed surgery, we would do it immediately.
And you have a very specific skill as an orthopedic surgeon, and I think I understand that your mission was to bring supplies for the current mission and for future missions. And so when you were there in Gaza, did you have access to anesthesia and other very critical supplies for surgery already, or are there all supplies that you have to bring yourself with your team?
So we brought 100% of the things that we planned on using and brought things that we planned on using for future missions. When I went, the Rafah border was still open, and we were able to we brought over 80 suitcases that we brought in through the border and purchased ourselves. That included orthopedic hardware, that included anesthesia medications, that included antibiotics. However, this time around, because we are going through Israel, we're only allowed two suitcases per individual traveling,
Mm.
and no medications are allowed through the border from when we're going through Israel. And we can't bring any hardware with us as well. So thankfully, a lot of our orthopedic hardware that we brought on our previous missions remains, but we have been trying to secure anesthesia medication so that we can properly do our surgeries. And earlier in the war, that was a major problem where there were no anesthesia medications. They were not allowing any opiates or pain meds through the border, and it essentially made operating impossible. I met a physician, a surgeon, who had to amputate his niece um, on his kitchen table without any anesthesia medications. And that was the reality early on in the war. Thankfully, we were able to bring some medications with us, but it is a huge concern for us at this time around.
And I know we're really just sort of scraping the surface of the experience, and I think it's unimaginable for most of us, I believe, and with the picture that you've painted, and also just your experience so far. I mean, being a physician itself, I imagine there's already a lot of weight with that, but having to make these very, I imagine, quick decisions and to see the amount of suffering and having to decide on the spot, who gets surgery and who doesn't. What goes through your mind when you're in that situation and when you have to make those decisions as a physician?
Well, thankfully, I had good training that prepared me to make these decisions. I mean, throughout
Mm.
all of my training at Yale, we were forced to make decisions, and we were questioned about our decision-making process, and that's kind of part of your training. And at the end of the day, you are making very real decisions, and you are making decisions that has to prioritize somebody over the other. And you do that with your best judgment, and you hope that you make the right call, and you rely on your training to make those decisions, but it is a difficult decision.
And you shared with us earlier too that you have family in Gaza. Have you been able to connect with them during your trip?
So yeah, through the UN, they were we traveled through the UN. They were very hesitant about us leaving the hospital. My family did come visit me every day. Somebody from my family would come to the hospital and essentially look for me. So the cell phone network is totally out over there, and the hospital that I was at housed 35,000 refugees, and so without cell phones and without being able to contact me, they would just run around the hospital. They had traveled an hour to get there due to how bad the roads have been, and just look for me until they could find me. And so I would either be in the operating room or I would be in the emergency department treating patients, and they would just have to look around until they found me. And I also spent an afternoon with them on
Mm.
the night before I left. Um, and that's when I was able to see the true destruction of what was going on. I traveled to North Gaza, and I saw the main road, which I traveled on very frequently when I was a child. The Gaza Strip is very small. You can get from South Gaza to North Gaza in about an hour. It took us over 2.5 hours to make that trip this time.
Mm.
And every single building on either side of the road, whole neighborhoods were destroyed. Um, Luckily, one of my uncles house was destroyed. He's living next to another uncle who I went to his house and visited, and he's living in a tent out there. And so I was able to hang out with them and talk to them, and it was and kind of gauge how they're feeling.
And what was that like for you? I imagine a little joy, a little not so joyous for obvious reasons, but what was going through your mind when you're both there, as a person and as a physician, seeing your family?
So I believed I made them very proud by leaving
Mm,
the comfort of the United States and going to a war zone and treating the people there and they're extremely happy to see me and kind of very proud of me that I didn't forget my roots. But for the first time ever, I felt like my family was truly hopeless. Um, Gaza has been through many wars in the past couple of years. But this time it is by far worse than anything before. My uncle said this is worse than the 1948 Nakba, which my
mm,
grandfather literally marched from his house in present day Israel, Beersheba, and marched to Gaza. And my uncle saying this is by far worse than that, where millions of peoples are uprooted from their homes and leaving. And I could truly see how hopeless they were and
mm.
how helpless they felt.
And you are spending a little time here in the US, but you're traveling there really quickly, I believe, this coming weekend. Do you expect to see the same things, I'm assuming?
I think it's going to be a lot worse,
Mm,
a way worse scale. So when I was there, I was mainly in Rafah and Khan Yunis, southern Gaza, where Israel hadn't invaded that part yet. But the destruction now, so everything that I saw is totally destroyed. When I entered Gaza at the border, I took a picture next to a sign that said, I love Gaza. And there's a video on the internet of a tank just running it over for fun. Every house, the safe house that we were at, was evacuated. Um, all the refugees that were at the hospital that I was working at have evacuated. So all 35,000 people have now moved to somewhere they deemed safer, which it feels like nothing is safe at this point. I think we're actually at the worst part of the war right now, and the civilian casualties is just increasing at a substantial rate.
And you're traveling back there again as a physician. Can you share with our listeners and tell them a little bit more about the organization that you're traveling with, Fajr Scientific?
So Fetcher Scientific, I got involved with them pretty early on. They did do a mission in Gaza prior to the war. One of the reasons I got involved with this organization is due to the long-term goals for the health of Gaza. A lot of times in mission work, it's not just about going and doing surgeries and then leaving.
Right.
The idea behind Fetcher Scientific is to train uh, the residents and physicians there in order to be able to manage complex care themselves and also they hope to establish a hospital and really provide supplies and support in any way possible. And that was one of the reasons why I actually really got involved with this organization was because of the long-term goals. And whenever we went there this time, we actually provided 500 meals a day for the refugees through donations that we brought with us. We also we provided the healthcare system a break. All the hospital workers there hadn't been paid since October, and we also provided payment to the hospital workers who hadn't been paid for October since October, and really just provided them with supplies as well because they're so low on supplies.
And would love for you to share any final thoughts for our listeners. And we've had conversations about the humanitarian aid efforts before. What do you hope our listeners get from this conversation today?
I mean, the biggest thing that we can do for preservation of life is to stop the war. Unfortunately, all the work that I did, as we saw last night, can be destroyed in a single airstrike. The only thing that we can do to save lives is stop the war. And I'm trying to do as much as I can to help the people, but it is such a small fraction of what's happening there. And I think that we all need to vocalize our concern for the loss of innocent lives. And this doesn't have to be a political issue, and nothing that I've ever spoke on has been political. This is a humanitarian issue. And I really think that it is our obligation as humans to speak up for these people.
You've been listening to Dr. Ali Alaidi, who's an orthopedic surgeon with Fajr Scientific, which is a nonprofit organization that provides surgical care to vulnerable populations. Thank you so much, Dr. Alaidi, for being on Where We Live today. Safe travels to you and your entire team.
Thank you so much.
Coming up, we continue our conversation about the ongoing situation in Gaza, and we touch on the legal definition of genocide and how that word could change the conversation and access to aid. Later this hour, we'll also dive into the crisis in Sudan. You can join the conversation, 888-720-9677. That's 888-720-WNPR, or leave us a comment on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. Today, we're taking a look at humanitarian crises happening around the globe, and we'll hear more about Sudan in a bit. But now we're checking in on aid organizations who are currently in Gaza. And joining us now is Pravash Budden, who's the AmeriCare's Deputy Senior Vice President of Emergency Programs. Pravash, thank you so much for being with us today.
Thank you, and good morning.
Good morning to you. And we also have Dr. Abdelillah Douda, who's the coordinator of the Sudanese Refugee in Connecticut and digital coordinator of feeding centers. Dr. Douda, thank you for being with us today, too.
Thank you for having me this morning.
And also with us is Nathaniel Raymond, who's the executive director of the Humanitarian Research Lab at the Yale School of Public Health. Thank you, Nathaniel, for being with us this morning.
Thank you for having me.
And for our listeners, you can also join the conversation. Give us a call, 888-720-9677, or find us on Facebook and Twitter at Where We Live. So, Pravash, you were listening to the conversation earlier with Dr. LID. Would love to just get your thoughts on anything that jumped out to you that you would like to respond to.
Yes, thank you so much. It was so interesting to hear Dr. Laidi's vivid account of his experiences as an orthopedic surgeon in Gaza. Reminded me of the time that I lived and worked in Gaza in 2009 as a aid worker, providing frontline assistance to people affected by that 3.5-week war at the time. And now what we see in Gaza is so much larger, and the impact of the violence there has been tremendous on millions of people. And over the past 8 months, AmeriCares has been providing medicine and medical supplies to people of Gaza, and we've moved in over 19 tons of medicine and medical supplies that can serve over 200,000 prescriptions to people, and also supporting medical mobile teams, and also really doing much more work around mental health for frontline healthcare providers like Dr. Eladi, who face the type of trauma and the stresses that they see working with patients every day. And so we really do feel that it's important to support the doctors, the nurses, the pharmacists that are doing that important work. But as Dr. Eladi also pointed out, it is increasingly frustrating to not be able to get more and more aid into Gaza because of closures on the borders in Rafah, and also in the north as well, in the border crossing over there. And we really do push for a ceasefire so that we can get more aid into Gaza and serve the population that is greatly affected, and address their health needs. As you know, with millions of people that have moved through Gaza over the past several months who are multiply displaced, their health needs are compounded because they don't have access to medicine, they don't have access to critical care. Transportation routes are also compromised as well as people move around and look for safe spaces. And as people crowd into different shelters, be it at the schools, be at clinics, be it out in the open as well, we see much more in terms of infectious disease spread. And we see, the impacts of poor water and sanitation access really compounding and creating a dire situation that we need to address over a long period of time to make sure that people are staying safe and healthy.
And Nathaniel, compared to other humanitarian crises that we have seen and are still seeing, can you talk about how extreme is this situation? Because it does seem like it's more extreme than what we've seen in the past because of issues of access. And Dr. Laidi also alluded to that earlier as well.
What we're seeing in Gaza is as extreme as it gets, Catherine. We are talking about a health system that is barely functioning, as we heard from Dr. Laidi. We are talking about people in a high density, low mobility scenario in an urban environment. And that's the worst type of humanitarian emergency because it means you have multiple pathways for additional casualties. And it's important to bear in mind that there's 4 types of casualties that we're seeing in this dense environment. Direct death and trauma from the actual fighting. The second is fatalities due to lack of medical care for people who have been hit in the fighting. The third is basically a set of casualties related to lack of basic needs, food, water, medical care. And the fourth are those with chronic conditions ranging from heart issues, kidney issues, cancers who are not receiving treatment due to a lack of medical care. And so all 4 of those things are happening at once. It's as bad as it gets.
And with that in mind too, Nathaniel, there has been resistance to classify what's happening as a genocide. Can you talk about the significance of that and at what point do you think that might change?
Well, I think that there has been a large amount of focus on words. And I think what we really need to go to is, regardless of what we call this situation legally, there are 4 principles underneath what's called LOAC, the Law of Armed Conflict, that apply here that are not being respected by both IDF and Hamas. That is, the first principle is called distinction, which is being able to separate civilians from combatants. In this environment, that's almost impossible. The second is the principle of precaution, that all forces are responsible for taking precaution in how they use lethal force. Precaution, particularly what we've seen at Rafah in terms of the recent airstrikes by IDF that have killed dozens in at least 2 incidents. We have a serious precaution problem. The third is proportionality. Is the use of force proportional to the military necessity? And the fourth and final is military necessity. When you have tent encampments being hit with large bombs by IDF, that asks the question: was there precaution? Was there necessity? Was there proportionality? And the onus is on armed actors to ensure that. So regardless of what we call this, we are looking at pervasive failure of the basic rules of war by IDF, and also in the case of Hamas, being in those environments is causing risk to civilians. And they are, in the case of Hamas, manipulating the civilian density in a way that puts civilians at risk. And so at the end of the day, it's not about whether we call it genocide. It's about the basic rules of the laws of war being respected.
Well, and with the law in mind too, talking about words, would classifying this as a genocide change the amount of aid that goes into the region, or does that not make a difference?
It frankly would probably make it worse, if that can be imagined, given the sheer lack of aid that's going on. We have an International Court of Justice decision that talks about the risk of genocidal conditions being in place, and we have the International Criminal Court talking about collective punishment. The fact is that these differences in words have political implications that have humanitarian implications. It's important right now that we put the words aside and really focus on the international humanitarian law requirements for Israel to ensure free flow of aid regardless of the political situation or the conditions on the ground, that they must allow aid in and people to move freely over.
And Pravash, would love for you to respond to that. Do you think classifying this, with a different definition would change the amount of aid that gets into the area?
Well, I would agree with Nathaniel that there are words, and we focus on the action for supporting humanitarian assistance into Gaza. There's a lot of political maneuvering at this time, but the fact remains that with the borders closed, even if it's labeled one item or the other, that has to change, and parties need to agree to be able to provide safe passage into all of Gaza. It shouldn't be piecemeal. There shouldn't just be small safe zones here and there for aid operations to operate under, but really to have unfettered and safe access to everyone affected in Gaza. And we've seen that this is an important part of doing aid work around the world when there are political decisions made to limit aid to affected populations. It really does go against the grain of international humanitarian law. We do everything that we can to advocate for opening the borders more so. And we want to make sure that the right type of supplies are getting to the people that are affected, be it food, water, medicines, which are the top ones that need to be entered into Gaza immediately. Obviously, there's a small amount of aid that does get in, but it's nothing near what were pre-October 7th supplies getting in. And even that was piecemeal and didn't provide all the material need and support for people living in Gaza. And so it's important that we as a humanitarian organization at AmeriCares, along with our colleagues in the aid sector, really do focus on the type of operational solutions that we can work on with all parties to ensure that there's more effective and longer term aid that does get into Gaza.
Well, and
I just want to build on what Pravash is saying, which is a child can't eat a judicial opinion, and you can't bandage a wound with a legal finding. At the end of the day, what we are talking about is the most basic obligation of all state and non-state actors during war, which is humanitarian aid under the Geneva Convention must flow freely based on need, period. And right now, that just is not happening.
And building on to that, we're also talking about another region that is in dire need of the aid that we've all been talking about this morning, is Sudan. And the International Rescue Committee, which is a humanitarian aid organization working in more than 50 countries and across the U.S., is describing the situation in Sudan as the world's largest displacement crisis, with many facing extreme hunger and many women facing sexual violence. The conflict in Sudan began over a year ago in April 2023 when fighting broke out between the Sudanese Armed Forces, which is the official military forces of Sudan, and the Rapid Support Forces, which is a paramilitary group. And this week, the latest update is the Rapid Support Forces attacked a village in Sudan's main farming region, killing over 100 people, which included children. And that's according to reports from the New York Times. And so, Nathaniel, is based on what we've been talking about, and of course, Gaza isn't the only area in the world that's facing a major humanitarian crisis right now. Can you also tell us a little bit about what's happening in Sudan and the history that led up to this point?
So my team and I at the Yale School of Public Health Humanitarian Research Lab, we monitor Sudan every day through commercial satellite imagery and open source information. And we've been reporting almost 11 reports in the past 8 weeks on the city of Al Fasher, which is 800,000 more people than Gaza and about the size of Brooklyn and with the population of Kansas or Mississippi. And so what's happening in Darfur right now is the Rapid Support Forces are attacking the Sudan Armed Forces in the last safe haven for people who fled the 2003-2004 genocide in Darfur. And basically, what's as of this morning, there's artillery fire from multiple directions. A large portion of the city has fled, and we're talking about a level of violence that has raised, just in the past 8 weeks or less, 40 communities to the ground along ethnic lines. In the case of Wadi El Noura that you're talking about, we're seeing increasing evidence that there was a massacre there in the past 48 to 72 hours that killed dozens, if not more. And basically, this fight that started in April of last year is the result of a internal battle between the army and this rapid support forces unit, which most people know as the Janjaweed, that was involved in the Darfur genocide of the early 21st century. And basically, after the Bashir government was overthrown due to civilian uprising in the transitional period, fighting has now broken out between these two military elements that has caused the largest displacement crisis in the world. Sudan is the largest displacement crisis in the world, and its capital city, Khartoum, and its twin city of Omdurman have been devastated. And so at this point, we're looking at what's called Integrated Phase Classification 5, which is a technical term meaning we're seeing a famine potentially occurring across Sudan. And we are seeing a war now in its second year that has gotten little to no attention, and it's probably the worst armed conflict at scale in the world, with millions affected. Just in El Fasher alone is 800,000 more than Gaza.
And Dr. Douda, we mentioned the conflict started to happen in 2003. Can you talk about how dire is the situation right now? I know Nathaniel has given us an image, but compared to the situation in 2003, can you talk about whether or not the humanitarian presence is as robust, or has there been a major change there?
The humanitarian situation in Sudan is very complex because the fighting is going all over the country, and people, the army and the rapid support forces are controlling some areas of the country, and they are standing as obstacles for humanitarian effort to be delivered to the needy people in these areas. What makes it worse, the interruption of communication, and people are cut off from, international community to know exactly what is going on in Sudan. Mm-hmm. So this makes the situation, worse, and humanitarian efforts are limited. Last fall, we coordinated a visit to check for the refugees who fled West Darfur to Chad with Sudan Sunrise from the United States, and we witnessed an appalling situation. That's a really catastrophic situation where people lost their loved ones, and they lost their properties, and they came to Chad in a very dire and catastrophic situation, having nothing. Despite all these, appeals from different entities inside the country and outside the country, the humanitarian response to those people who fled Sudan, either to Chad or to Egypt or to Uganda, is still inadequate.
And Nathaniel, building on what Dr. Douda just shared, we've also mentioned earlier that there are reports coming out that women and girls are at a very high risk of sexual violence as a weapon of war. Can you talk about what's happening there?
Well, I just want to say it's really an honor to be on the call with Dr. Douda, who's a real hero in the work that he and his colleagues have been doing for the Masali in Chad. Just needs to be praised. So it's great to be on with him today and hear his voice. What's happening in terms of the contours of the violence in Sudan as you mentioned, includes sexual gender-based violence in the case of RSF attacks in Darfur, SGBV, rape, sexual assault is a core part of how those attacks occur. Women and in some cases girls are raped. Men are targeted and killed by RSF along ethnic lines, particularly from the Masalit for Nzagawa communities. And people have been displaced from their homes through the use of arson. In the case of elsewhere, we have Sudan armed forces have engaged in indiscriminate bombardment and detentions, and also allegations of sexual and gender-based violence against their forces. And so the ability for humanitarian aid workers to even assess the situation because of the intensity of the fighting is so bad that and as Dr. Douda said, the telecommunications system has been so affected that in many cases, some of the only ways we can tell what's going on is from space, by looking at fire sensors and looking at satellite imagery, because the ground access has been so degraded.
Well, and Dr. Douda, you mentioned earlier too that the fact that there's no food, no water, no medical care, all of that has exacerbated over the last year. Can you talk about how are people being impacted by hunger and famine? Are they able to get some supplies or no supplies at all?
I witnessed firsthand. I went to the city of Adre, which is the border between Sudan and Chad, where around 800,000 or 1 million Sudanese from Darfur fled to Chad. I sat down with the people, I listened to them, and those people came to Chad literally with nothing. They don't have, money, they don't have properties. And the humanitarian response, as I said, was very slow. And until today, despite the presence of WFP, World Food Program, and UNHCR, United Nations Commission for Refugees, and other organizations such as Medicine Sans Frontier for medical care and all this, the magnitude of the plight of those people in Eastern Chad was so huge, and the assistance that is provided by the international community is not covering the even 25 or 35% of the need of those people, and especially food and shelter and medical care. Until today, people around 200 or 300,000 people around the city of Adre are living in the open, or some of them are living in a small shelter made by local materials, and a few of those people were transformed to refugees camps, which were established by the United Nations, like 3 refugees camps in Mache, Abtenge, and Achana. Those they are having shelter like makeshift of plastics, and food distribution is very, very little, and medical care is also very little and inadequate. So this is the general situation of the refugees who fled to Chad. Those are who are living in the refugees camps. Some of the refugees now in the big cities like in Abashan and Jamena inside Chad, those people are receiving nothing for the time being, because when they came from Sudan, they had something and they decided to be in the cities. But few months after they spent whatever they have, and now they are living in a dire situation and catastrophic situation.
You've been listening to our panel of experts from the humanitarian aid community. And coming up, we will continue our conversation on these global crises. You can join the conversation, 888-720-9677, or leave us a comment on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. More than 14,000 people have been killed in Sudan, and more than 8 million people have been displaced. That's according to a recent report from NPR. And joining us now to talk about this conflict is our panel of experts. We have Pravash Budden, who's with AmeriCare's Deputy Senior Vice President of Emergency Programs. We also have with us Dr. Abdelillah Douda, who is a coordinator of the Sudanese Refugee in Connecticut, and also Nathaniel Raymond, who's the executive director of the Humanitarian Research Lab at the Yale School of Public Health. So, Nathaniel, we've been talking about this conflict that started before the recent war in Gaza, but has been much more underreported. So, can you talk about what are some of the parallels between those two humanitarian crises, and why is Sudan being underreported, you think?
Well, I think as someone who's been in Washington and London and Paris in the past few weeks talking to governments about Sudan, there is, I think, a fatigue with the situation in Sudan that has had so many conflicts over decades, where there is a sense of exhaustion and frustration about what to do. And I think that precedes what has happened in Gaza. And additionally, the scale of the crisis in Sudan against a humanitarian system globally, where humanitarian aid dollars are so stretched. We have situations in Ukraine, in Somalia, and the list goes on. In addition to Gaza, that there has been this sense of sort of paralysis, and then also the fact is that the war in Sudan is a proxy conflict. The United Arab Emirates allegedly is supporting rapid support forces. There's involvement of Iran and Russia on the Sudan Armed Forces side, and so Sudan's conflict is not just about Sudan; it's about regional power dynamics, and I think that has complicated an ability to have concerted and consolidated international action.
And Dr. Douda, as we continue the conversation about, as Nathaniel's mentioned, the list of the conflicts keeps getting larger and larger. What options do refugees and displaced persons have, really?
We think the ideal way of solving the problem of the Sudanese refugees is to put pressures on the fighting factions of the Sudan to stop the war and to let those people go back to their houses and to their towns. Whatever assistance or humanitarian assistance are sent to those people in these refugees camps or in internally displaced areas would not be sufficient enough, to alleviate the suffering of these people. We, from the beginning of this war, as people involved in the Sudanese issue in the diaspora, we appealed to the international community and we put 3 steps for tackling the issue of Sudan, which are first providing security by stopping the war, and then humanitarian assistance to the people who are in need of this assistance for the time being. And the third point is to render justice for those people who are wronged. These 3 steps will, if it is, they are maintained by the international community and put pressure on the fighting factions, the Sudanese army and the rapid support forces. This will be a major issue to solve the devastating humanitarian situation of these victims of Sudan.
And Pravash, we have a couple of minutes here left, but I do want to ask, coming up next week here on Where We Live, we're going to be talking about hurricane season, and extreme weather events are actually causing a lot of humanitarian crisis as well throughout the globe. Can you talk about how this impacts that aid?
Yes. As we see, the world is changing. Climate is having a tremendous impact on human health. And we see that play out across the world. Just over the past few weeks, there's been a numerous amount of storms and tornadoes in the Midwest of the United States. There is a current heat dome over the southwest of the United States. There's been flooding in the Philippines, in Afghanistan, in Colombia, Brazil, the list goes on. And it's more intense now than we've seen before on record. We also see that people are affected by these changes and need more access to health and health supplies. For example, wildfires are creating air pollution that affects respiratory that create respiratory illnesses that haven't been seen before in many populations. Floods from hurricanes and tremendous amounts of rainfall create massive displacement. They limit access to medicines and medical supplies, and are also create more infectious diseases in populations that are traditionally vulnerable to not being able to get the right type of medicines and supplies in time. Heat has been a huge factor in the United States and elsewhere. Just last year was the highest recorded number of deaths in the United States, over 2,300 on record. And we see that that might be gearing up for another record year this year. And so as we put all of this together and look at especially the hurricane season that can bring a tremendous amount of devastation, we want to make sure that we are looking at resilient health systems that can respond to and support people in need. Obviously, these type of climate changes and severe impacts first create a lot of death and injury to multiple populations, but then there's longer term health needs that are requiring this type of support that AmeriCares provides through direct health clinic support. So this means strengthening health clinics to be able to adapt and cope to more patients coming in, looking to see how we outfit them to manage those that are seeking heat-related illnesses, making sure that their medicines and medical supplies are well stocked, and planning ahead so that we can talk to communities about what they need to do to be able to prepare. A part of this is just individual preparedness as well, where we have plans that we can issue to individuals who can then prepare their families with the right type of information, types of the kits they need, the type of medicines that they need, as well as where they may go to seek safety during times of crises through hurricanes or wildfires or floods. And so the concern we have is that we repeatedly see this over and over again and focus on the type of communities that are underinsured, as well as those that may not have all the type of access to healthcare that you and I may take for granted.
Well, and
I'll have
to stop you there, Pravash. So sorry, but we're running out of time. But thank you so much for the valuable information that you're providing for us. And I just want to take a moment to thank our panel of experts for joining us on Where We Live today to share their experiences. And for our listeners, just a note that Connecticut Public is continuing our coverage on conflicts in Gaza and across the globe. You can visit our website, ctpublic.org, to learn more. I'm Catherine Shen. Today's show is produced by Tess Terrible. Our technical producer is Jean Amatruda. Download Where We Live anytime on your favorite podcast app. And thank you so much for listening.